Veneers, we take off a little bit in the front. So that's the difference. And I'm on live. Come on. Come in. What you need, baby? I'm live. You got a treatment plan. Thank you. I'll be right with them. All right. So yeah, +1 events for your grand opening. Yes, the grand opening, that's Heavenly Beauty. Yes. Let's see what we got here. My teeth shifted, which is why I'm not eligible for implants. Now, don't lose hope. You probably can do ortho to make room for your implants and or do crowns adjacent to the implants. So it's always a way to make it work. So yeah, usually if your teeth shift, they probably put you in maybe some Invisalign braces to actually open that space up to make room. How do you treat cavities? Cavities, what we do is we go in and remove the decay. You remove the decay and we put something in. Usually we put a base in to keep it from hurting. And we put well, we don't use amalgam. Well, I don't use amalgam anymore, but it's a composite that you put in to bring your tooth up, to repair your tooth. Good morning. How would a person on disability get one implant? How much would they have to pay a month for y'all to make a payment plan? One implant runs about $47.99. Now that's A to Z. The implant is, I think, $14.99. The abutment is something, and the crown is $17.54 crown. So total $47.99. We do have payment plans. I think they come in like $2.99, $3.99 a month. They're based on credit. You don't have to use your score, so it is based on your credit. Hopefully that answers your question. I know you, Roll. Stop playing with me, Roll. I don't know what that means. Do implants move if your mouth shifts? I was told some shift. You know, there are a lot of things that can play a part in an implant shifting. Usually they don't. Usually once I put that implant in and it integrates and you're healthy, the only thing that causes really problems with implants are infection, diabetes, and smoking. Usually after that implant integrates, it's usually in there pretty good that I can't even really extract it. Your natural tooth would be easier for me to get rid of. With implants, you do have to brush, floss, all that, keep your mouth hygiene, because a lot of people feel like they got an implant, they ain't got to worry about it anymore. You can get something called perioimplantitis, meaning by definition, perio around the tooth, implant around the implant, implantitis, meaning infection, inflammation around the implant, and that will cause bone loss around the implant. You will lose the implant. So just like a tooth, you have to take care of it. You can't just put it there and say, hey, I got an implant, I don't have to brush. A lot of people take that wrong, and we try really hard to educate our patients. I know you know a lot of doctors. Yes, I do. How to close a gap affordably. Everybody's a little bit different. When you talking about closing a space, are you talking about veneers closing the space? Do you have decay on the adjacent teeth? All that plays a factor. That's why I always tell people to come in for a consultation. We can take a look at you. Our consultation, straight up, they're $300, but that $300 goes towards your treatment.